I was a career woman. I worked for 30 years and worked for UNC for 18 years. In 2012, I was laid off. Our office closed due to funding, and I had no job. The year before I lost my job, I had a spinal cord injury, but I was lucky I had insurance. So I lost my job, no insurance, and no one has any idea how much medical need I have with a spinal cord injury. I was so panicked. I spent weeks and weeks and weeks trying to figure this out. They said I could go on Cobra. Well, that's $500 a month just to have the insurance, plus the co-pays and everything else, and I didn't have a job. That wasn't going to work for me. So then, because I have a master's in public health and I knew some resources, before I went to this resource, I thought Cobra's not going to work. I'm just going to call Blue Cross Blue Shield and see if they could give me a better deal. I called Blue Cross Blue Shield, told them my story, and they asked me about my health. And after my story, they said they could offer me insurance for $3,000 a month. Who in their right mind would do that? Who in their right mind without a job could do that? So then I thought, what next? Well, I knew about the community health centers in our country that a lot of people don't know about. So I went to the Piedmont Community Health Center in Hillsborough, which serves the uninsured. I got a primary care doctor there. I paid $20 a visit to see the doctor, no money for labs, and $10 for my 8 prescriptions. I did this for 3 years. The best care I've ever gotten, to be honest, and that is a lot for me to say. I applied and applied for jobs. I have a master's and can't find a job. I got a job in 2014, and after a year I was laid off from that job. Since then, I have been looking for a job. I have probably applied for 500 jobs and have not yet found a job. So 2 years ago, out of desperation, I went on disability so that I could get Medicare. And on some level, I feel ashamed because I can work, but I needed the health care coverage. And even with Medicare, I am so grateful. I've been in the hospital 3 times at UNC and owe them $8,000 that Medicare would not pay. So I have a lifelong commitment to UNC to pay them. So that's kind of my story about health care, and it just makes me very sad to have felt like I didn't have a right to have health care. I feel like it is my right. And I worry in the years ahead, as a person with a spinal cord injury, I don't know what my health is going to be ahead. I don't know what that trajectory will look like with my health care complications, and that scares me. So I now have a part-time job while I'm looking for a full-time job, making ends meet, buying the senior Diet Coke at McDonald's rather than the $1.79 Diet Coke, and praying that I don't go in the hospital or have a pressure sore or a bladder infection anytime soon. So I am thankful for Medicare, but I think to be honest, everybody should just have medical health care. And I don't think I should be paying most of my minimal income to cover my health care. Thank you.